So please, Raina, would you be kind to go ahead?
Sure. Thanks, Yanir. So it's been interesting in Australia because 2020 was really characterized by a very low COVID environment and at times a zero COVID environment. Australia implemented a travel ban. When WHO was saying do not use travel bans, Australia implemented a travel ban on China, solely on China, at the beginning of February, which was right at the peak of the Wuhan epidemic, and then brought in travel bans against South Korea, Iran, and Italy in early March when those three countries started to have a surge of cases, and then closed the international borders entirely in the middle of March 2020. And that really has left us in a good position for most of 2020. We had a very small first wave in April 2020, which was more than 60% imported cases that had come via travel from overseas. So not a lot of community transmission. And then the timing of the closure of the border meant that it never really took off and got entrenched in Australia. Then we had a moderate second wave in the state of Victoria, where the city of Melbourne is, around July, August, September 2020. But at the peak of that epidemic, it was only about 700 cases a day. So again, not a huge second wave, but nonetheless, it was caused a huge stress on the health system there, and we had a lot of healthcare worker infections, over 4,000 in that outbreak. And then there were a few small outbreaks over Christmas, New Year, and what characterized the whole response became very politicized. So we are a federation, and the current federal government is a one political persuasion, the Liberal Party, and we saw a real polarization of the states based on whether the ruling party was Liberal or Labor. And so we saw the Liberal states, including New South Wales, where I'm based, and Sydney, the biggest city and the biggest state in the country, also the state that receives the majority of international arrivals. We saw a calculated strategy to avoid lockdowns and to say we can test and trace our way out of any outbreak. So we had, at the same time, Melbourne was having the second wave in 2020. We had a similar outbreak begin in Sydney, but they managed to control it without a lockdown, with really extensive testing and tracing. So they were able to contact trace all the cases and quarantine the contacts, etc. And it took a long time to bring that under control, a few months, but it came under control without a lockdown. Whereas in Victoria, I think the difference also was in the health system. So Victoria had a very bare bones, kind of decimated health system, which just fell apart under the stress of the second wave. They were not able to keep up with contact tracing, so they had to use a lockdown, which went on for 3 months. And whereas New South Wales had a better resourced health system and a more decentralised health system that was able to do this really expanded testing and tracing. Then we had another small outbreak over Christmas, New Year in Sydney, which again was controlled with very localised lockdown. It was in a peninsula area of Sydney that was quite easy to lock down separately, and that was brought under control as well. Meanwhile, in the rest of the world, in many other countries, vaccination programs began towards the end of 2020. In Australia, there was nothing. When 2020 came to an end and 2021 rolled around, there was no announcement, no plan, no statement of what we were aiming for, nothing at all. And this absence of policy direction or planning. And so several of us, called out for a plan, a vaccine plan, and diversification of vaccine procurement, etc. The vaccine procurement strategy was very narrow. all the eggs were put into a couple of baskets, and also there was a plan to invest in one of the locally manufactured vaccines, which fell over because that vaccine didn't get past the initial development stage, and which then left us with a very small contract for Pfizer, a very small number of doses, and a larger contract for AstraZeneca to be manufactured locally in Australia. We do have, one manufacturing facility, which is an advantage, and then a contract for Novavax. So that when the University of Queensland vaccine fell over, instead of diversifying the vaccine procurement options, they opted for more AstraZeneca. So we put a lot of the eggs in the AstraZeneca basket because that vaccine could be manufactured locally. And then there was a concerted messaging campaign to say that it's not a race. We heard it from our chief medical officer, from our prime minister, that vaccination is not a race, that we could afford to sit back and watch the rest of the world and take our time. So by the time our most recent outbreak started, which was in Sydney, the vaccination rate in the country was less than 4% fully vaccinated, and that was in June of this year, when other countries had, surpassed 60 to 70% of the whole population fully vaccinated. We had only 4% vaccinated. So we were suddenly stuck in this situation where we were among the lowest vaccinated countries in the world. We did not accept that SARS-CoV-2 is airborne, so that's been another problem that's beset all our responses, is a denial of airborne transmission, heavy focus on hand washing and, keeping a distance of 2 meters between people, and surgical masks. And so we had this outbreak occur, which started from a limo driver who was driving passengers arriving at the international airport to their accommodation. And of course, I'm sure the limo driver had hand sanitizer in his car, but nobody had told him to open the window or wear a mask. So he got infected, and it set off an outbreak that started off in a very affluent part of Sydney, but then spread rapidly to lower socioeconomic areas where it really took off. And that then created a pressure on both the guidelines for infection control, hospital infection control, as well as vaccination. So suddenly it was a race. From not being a race, we were in the race of our lives, and the vaccination infrastructure was expanded to bring in, big public vaccination hubs, etc. And really, we did have a very rapid vaccination campaign and got the vaccination rates up to about, I think it's around 65% of the whole population 65% of the whole population fully vaccinated, 74% partially vaccinated. So, I think in the end, and we did have the vaccine supply diverted to Sydney and Melbourne largely, which was Melbourne also had an outbreak, a big outbreak, bigger than the Sydney one, and then we saw the outbreak spread from Sydney to regional parts of the state, to Aboriginal communities, which had very low vaccination rates compared to the big cities. We had a very bad outbreak in a small, remote Aboriginal community called Wilcannia, and that really put the spotlight on this issue of equity and, leaving no one behind. In the meanwhile, in August, we formed a group called AusSage, which was built on the independent SAGE model, but it was launched at the beginning of September, really in response to the situation we were in with this escalating outbreak and low vaccination rates. And we really pushed some key platforms, which is that we would aspire to live with occasional outbreaks, but not widespread disease, that we believe that elimination in the technical sense was achievable, that there had to be a focus on safe indoor air, ventilation, and vaccine plus, which meant vaccines alone were not going to be enough against the Delta variant, and leaving no one behind. So really focusing on people who had structural disadvantage or were medically disadvantaged or vulnerable, and ensuring that all those groups were not left behind with vaccination targets. So we really pushed for vaccination targets to be met in regional and remote areas, so that you wouldn't have Sydney-siders travelling to the country towns as soon as they could and taking COVID with them to under-vaccinated towns. And I think we have had quite an impact. We've had uptake of all the advice we've put out on, opening businesses, on safe indoor air, on schools and children. And we've really promoted the message that vaccines alone are not enough. Unfortunately, the official policy is still largely relying on vaccines. So we're now in a position where case numbers have come right down in certainly in Sydney. They're coming down in Melbourne, and everything's opened up domestically. States that have had zero COVID, like Queensland and Western Australia, have been pressured to open their borders to states that do have COVID. And international travel is resuming with no quarantine. So there's also individual states will have quarantine, but the biggest states that receive the biggest international arrivals, New South Wales and Victoria, will not have quarantine. Some other states will have home quarantine or hotel quarantine. So in a sense, we're having even less measures than, say, the UK, which has really had a let it rip kind of strategy. Testing on arrival won't be routine. For domestic travel, some states will have testing, but not for international travel. Contact tracing is also going to be scaled back according to what we've heard. So things like QR codes, which have been a big part of the success of the contact tracing in New South Wales, are going to be scaled back. At the same time, we've now had approval for rapid antigen testing and self-testing, home testing kits, etc. That's become available now, but quite expensive and really probably out of reach for most people. And there's no real planning around variants of concern, new variants, coming in from overseas, etc. So I think in a way it's a mistake to rely just on the vaccine-only strategy and think that everything's going to be okay because everyone's double vaccinated. We have approved boosters for everyone 18 and over for the third dose. That's good, but there's been no accompanying campaign to impress upon people how important it is to get that third dose, because really the data is telling us that with the vaccines we've used, that it's probably going to be a 3-dose primary schedule, that 2 doses is an incomplete schedule. So I think it remains to be seen whether we will continue to be reactive and slow, or whether we will be agile and responsive as new data comes to light about what's needed for control of the pandemic. But the biggest problems are we still largely deny airborne transmission, we don't mitigate it, and we are relying too much on just vaccines.
Thank
Thanks.
you very much. This is, I'm guessing you're drawing to a close. Am I right? We have time for some questions.
Yeah, sure. Happy to take questions. That's
one
kind of a
question
broad
that I have, and the narrative about this has been quite confusing, right? Because New South Wales actually has now only about 7-day average about 200 to 300 cases per day. And at the peak, there was about 1,400 cases per day. So New South Wales was actually successful in suppressing the outbreak, despite the fact that it's Delta, despite the fact that they didn't, do a severe lockdown. They did do vaccinations, they did do other precautions. It's not like they didn't do anything. So it was a vaccine plus strategy at that time. And now presumably they're throwing in the towel and opening things up, but they've actually demonstrated that they could control it. Is that
Yes. But that control happened at a time when, the outbreak happened when only 4% of the population was fully vaccinated. So they had to. There was no choice except to use a localized lockdown. So certain suburbs were locked down, and they were mainly low socioeconomic migrant suburbs. So there were a lot of problems of perceived inequity, etc. There was police and armed forces on the streets, right, enforcing the lockdown. So there were all the non-pharmaceutical measures were used, mask mandates, lockdowns, etc. But as soon as those vaccination rates hit higher levels, it was all relaxed. So the reason we used all those strategies was because the vaccination rates were really low going into it.
right? So in
And the
other words,
message was,
what I would say is that you actually demonstrate. People point to the fact that in New Zealand they haven't been successful to say, well, now long you cannot be successful. But actually, New South Wales demonstrated that you could be successful. It's just a
yeah.
question of deciding, right? It makes it clear that it is possible, but it is a matter of decision. And New South Wales decided to go the other way, which is unfortunate, of course.
It's possible, but in Victoria, which had had a lockdown of 3 months last year, there was a political view that having another prolonged lockdown was not going to fly, and that with an state election coming up next year, I think the government decided we're going to just open up. When we hit those vaccine targets, which was 70% of 16 plus fully vaccinated, which equates to about 55% of the whole population, that everything's going to be relaxed. So they relaxed all their restrictions with over 1,000 cases a day.
Yeah.
In both cases, I would expect to see a resurgence of cases by about mid to late December, based on some modelling we've done. The question is, I think we'll end up with very high vaccination rates, but the question is if we can get the children 5 to 11 vaccinated as soon as possible, and also ensure that the booster campaign for the third dose is tackled with the same enthusiasm as the primary vaccination schedule, then perhaps the outlook is okay.
All right. But the others have questions, please. Any other questions, please?
I did put a question in the chat about mask mandates, I guess. Is that's all provincially determined or state determined? Are they consistent still there? Because I think that's made a difference in Ontario.
In Sydney, they've dropped the outdoor mask mandates, and in Victoria as well. So, and they're going to keep reducing. Going to keep reducing the mask mandates. For example, it's not required in offices, indoor office spaces. You don't need to wear a mask.
But what about schools and congregated settings, long-term care?
Not mandated in schools. Not for primary schools. For the little kids who can't get vaccinated, not mandated.
That's not good.
That's a bad recipe, as we've seen in the UK and Alberta, other places.
Absolutely.
Yeah, I mean, we've already had numerous schools closed due to outbreaks, so I would expect, of course, to see. And we already know that the largest age group affected is the 0 to 19, so it's already predominantly in the younger, in children. Yeah.
Any other questions?
Yeah, sounds like a statement, but really a question. It seems like the common thread in here with policymakers is that they're still believing in the kind of the the pandemic of the unvaccinated, and that vaccinations are going to be sterilizing when they've been proven over and over again not to be.
Yeah.
This is happening even in New Zealand. They're saying the vaccination is your ticket to freedom, and they're committing to that. And sounds like they're headed in the same path. And the U.S. has repeated over and over pandemic of the unvaccinated. So it seems like if you could just convince leadership that this in fact is not the case, they might take the pandemic more seriously. The vaccination is not enough. That seems to be the myth that the policymakers can't seem to get past.
It's become so politicized, even with us forming this Aussage group, there's such a campaign in the mainstream media against us, and, certain health experts who are, political hacks, kind of regularly writing hit pieces against us. And it's just become really polarized, really politicized. But I don't think we're going to end up the same as the UK. For some reason in the UK, look, I don't know, but I think Australians are not going to accept their kids being infected en masse. And we do have a federal election coming up in less than 6 months. So I think that will play into it favorably.
Let's hope. We have 2 more questions, maybe 3, but we're running out of time. Let's try to answer very briefly. One question is from Tracy. Gosha makes a good case that vaccination only cannot end the pandemic. How can the vaccine only, especially children, be justified? I think we heard that just now. They're all okay. So then Evan is asking, have you been following the situation in China? If so, what do you think is most likely to happen there in the coming months? Why don't we stop there?
Well, it seems like they've invested massively in quarantine facilities, and they still seem to be taking elimination fairly seriously. And I've heard that Hong Kong likely won't open up next year either, because of mainland China. So I think it'll be interesting to watch. They've been very successful in keeping a zero or low COVID environment to date, and they have invested hugely in the quarantine side of things. What they haven't got is high efficacy vaccines. So whether they decide to go for a booster strategy with an mRNA vaccine, what they do on the vaccine side may have a big impact on how they control things in the future, because unfortunately the Chinese vaccines do not seem to be as highly efficacious as some of the other options.
Raina, thank you. I have to go on to our next speaker. Please join us. Let me elevate Shu-Ti, who is our next speaker. Shu-Ti, are you able to speak? And are you going to use projection, or are you just going to speak?
Yeah, I'm going to use projection.
Okay, so let me turn to screen share mode. And you know how to push on the screen sharing button and to project. Let's do it.
Okay, let me see.
Shu-Ti is in Taiwan and was key person in the outbreak of SARS a number of years ago, and she's been a major voice in Taiwan for improving safety. Please. Okay.
Thank you, Yanir. It's my pleasure to join this Global Health Summit and to share some insights from Taiwan. Okay, so I'm going to talk about how did we struggle to regain zero by a bottom-up journey. Okay, and this slide showed you that we, in 2020, only had 800 confirmed cases and 7 deaths. However, in 2021, in May, we experienced an outbreak. Okay, and at that time, actually, we didn't quite know whether we would be able to regain zero. And we have been advocating for continuing the elimination strategy and the zero target all the way. And all right, so what made Taiwan perform well in 2020? And what have led to the outbreak in May 2021? And then in May, what happened? and how did we regain zero? And then I will share my conclusion and comments. Okay, and what made Taiwan perform well in 2020? Probably almost everyone in Taiwan will tell you that it's the lessons we earned from SARS outbreak. At that time, we learned that this kind of disease had only non-specific symptoms and would be very difficult to diagnose if they did not have travel history. So the best thing to do is to prevent community spread, because community cases would be very difficult to diagnose and would cause a troublesome spread. Okay, so at that time, we learned that next time, when the next pandemic comes, the very important thing is to launch strict and early border control to keep the virus outside. And at that time, our people practiced mass masking, and our health system developed standard procedures for detection, tracing, quarantine, and isolation to clean up the cases in the communities. See, that's the elimination strategy, and we have practiced that in the SARS outbreak. And we also felt that at that time, the spread might just cause lockdown of hospitals and community. And that's the very painful memory, so that we actually, most of our people prefer the zero target for any this kind of fatal infection. And we also practiced our Communicable Disease Control Act using the authority to implement non-pharmaceutical measures to contain the spread. And also we improved our law to ban the spread of wrong information. And we also legalized the establishment of the Central Epidemic Command Center to have full authority when necessary. Okay, and last year we did kick off early border control against China. And the Central Epidemic Command Center was activated very early as in January, okay? And our health system, again, did their best to help clean up those cases already in our community. And our people, again, practiced a voluntary mass masking. And what's very special is that in Taiwan, our opposition party and many opinion leaders, we actually are keen to zero COVID strategy. So we have been asking the government to do more, to mandate universal masking, to expand border control, in addition to China, also to other countries early. And we have been advocating for mass testing and to procure vaccines as early as possible. But actually, in last March, when the epicenter shifted to Europe, at that time, our commander has said he would try to do his job without closing the border, and same the prime minister. So you see that actually in their minds, they didn't fully believe in zero COVID strategy. And we had to struggle all the way to get them in, okay? So, and then what happened to this breach? Okay, so last March, although eventually the government accepted our suggestion, but then the quarantine rule for crew members has been changed several times without consulting their scientific committee. And then the days for quarantine, the crew members were shortened from 14 to 7 to 5 and then to 3 in this April. Only 3 days quarantine with a negative test on the third day plus 11 days of self-management, which means the crew members may go everywhere. But 3-day quarantine and 3-day testing both are against the science. Actually, within 3 days, the false negative rate of the testing is almost as high as 100%. So it's like no quarantine for crew members. And also last year, the command center adopted a very strict, very constrained policy on testing. So one local government which tried to test asymptomatic inbound citizens and asymptomatic contacts was investigated as they have misconduct. Okay, and they were attacked by Net Army very vigorously. So actually, the government insisted precision testing, and they insisted that the government PCR testing can only be offered to people with travel history or occupation or contact history, etc., plus symptoms, and all testings must be done with a notification. So it's a very constrained policy. And we have only PCR testing by April, okay? And the capacity was very limited. And for vaccine policy, the government insisted that having domestic vaccine is the top national security priority. So they didn't prepare foreign vaccines adequate in advance. So then, actually, in April, after the policy shifted to 3+11, in April, a captain of our airlines was tested positive by Australia airport. Okay, and then we expanded the testing and identified a cluster with 23 or more cases. And then we also identified the outbreak in the quarantine hotel. And then also in early May, we found there were community cases in different counties and cities. And then the genome sequencing showed that actually these community outbreaks and the quarantine hotel outbreak and the crew outbreak, they were of the same origin. Okay, and this very busy slide is only to show you that immediately after May 10 that community cases were found, this automatically kicked off the level 2 alert. And then within 2 weeks, many interventions, non-pharmaceutical interventions have been launched, but they were launched by local governments in advance of the command center because the number of cases continued to grow and they couldn't wait. The pressure was too high from us and from the people. Okay, the school were closed in the decision of the Taipei city mayors and new Taipei city mayors. And then it expanded to the whole country, and also the whole country raised to level 3 alert. So all this happened very rapidly within 2 weeks. Okay, and for separate interventions, such as lockdown, we have been advocating for early lockdown, okay, as early as May 12th. And then I wrote a commentary published on May 16th, and also great thanks to Yanir. He has also published the op-ed in both Chinese and in English on May 20 and 21, talking about snap shutdown early and to make the scale smaller. And he gave the examples of New Zealand and Australia. But also there were voices from people pro the ruling political party. They said no need to aim at zero. We can use vaccine and early treatment to make it like a flu, exactly like what people said in other countries. So that kind of voice also emerged during that outbreak. So that's all the way struggling. Okay, but great thanks to the local governments. This is the mayor of New Taipei City Hall. He shut down public activities and asked for a raise to level 3. And the Taipei City Mayor Ko, he announced to shut down all schools, and they worked together to pull the command center forward to shut down the schools. And then they also talk about level 4 alert, which is actually complete shutdown. So the two mayors were considering and talking about level 4 alert, but unfortunately the command center wouldn't like to do it, considering the impact on stock market and 3C monitoring activities. But then our people, as I said, I proposed for quasi lockdown. I said, if the government did not do level 4, then let's do it. That's people, we can practice quasi lockdown, especially in weekends. And you can see the first weekend after the outbreak, all empty everywhere. The street, the shops, the public transportation, and although actually shopping was not banned and taking public transportation was not banned, people refrained themselves from these activities. And Google mobility data showed that we were practicing voluntary lockdown beyond level 3. Okay, and you can see this curve, the number of cases by date of onset, showing you periodic drop in case numbers about every 7 days. That's the effect of the quasi lockdown in weekends. And it's interesting that although everyone was trying to regain zero, but our central commander claimed again and again. These are from the reports on what he said. He said no intention to do lockdown because zero was not a rational target, and even with vaccine, it could not be zero. So he said it will become seasonal, okay? And again, and even until recently, still the same. Okay, and about the expanded testing, the local government used the donated quick testing kits to do the expanded testing in communities. They set up community stations, and also they call for everyone to get the test. And also they expanded the contact tracing using, for example, cell phone, cell phone messaging, or using the monitoring video to identify people with close contact and ask them to get the testing. And actually, the test positive rate was very high. So we still complain that the testing was not wide enough. Okay, but then afterwards, when the outbreak happened in southern Taiwan, actually they did the early lockdown and mass testing, universal testing early on. They have this whole building being tested and the whole villages being tested. Especially when we had Delta, a small outbreak in June 26, it was cleared very soon. Okay, and the home test kits were approved as late as June 12. Okay, and you can see our daily testing volume has been low, even with population size adjustment still very low. And we worry that we still need to expand the capacity of testing. Okay, and all those kinds of resources to support COVID patients during the outbreak. For example, we didn't have adequate isolation centers. We didn't have monoclonal antibody, and we didn't have those, for example, high flow nasal cannula machine to supply oxygen to patients. So actually, we and as I said, actually, our vaccination rate was very low, as low as lower than 1% when the outbreak happened. Okay, although now we have 73% of population vaccinated now, but at that time it was very low. And so far, and most of the vaccines we used so far actually came from donation.
Shu-Ti?
And
Sorry.
Yeah, I will close soon. Yeah, thank
Pretty
you.
soon, yeah.
Yeah. So you can see actually our cumulative case fatality rate was one among the highest in the world. Although we eventually cleaned up, but the case fatality rate was two-fourths of the world's average, and most of the cases died within 4 days of diagnosis or even before diagnosis. And we have a 13% raise in our mortality rate during that period as compared to 2020. Okay, and the nationwide survey, and we continue to speak up against the government, and we were criticized, but we were not lonely. Okay, 47% of our people were not satisfied about the control of the outbreak and about the vaccine supply, and they were very upset that the government denied that 3+11 was actually the cause of the outbreak. So what's the conclusion comments? You can see that our society, at least so far, supported zero COVID strategy, and the local government acted very quickly. And you can see even with limited testing capacity, low vaccination rate, inadequate medical resources, and only quasi, not hard lockdown, so only soft lockdown, still we regain consecutive zeros, although it took longer time. Okay, so what matters, as we see here, is the orientation. Whether you want to eliminate or you want to live with the virus. If you want to eliminate, then you will have smaller and smaller proportion of active cases in your community. You will make it smaller and smaller. But if you would like to live with the virus, then the number of new cases and new deaths would expand. Okay, and just like what Raina said about Australia, about other countries, yes, vaccination coverage and the pandemic fatigue might impose new challenges to the persistence of such kind of approach. Okay, and you can see Singapore. Actually, this is the curve of new deaths per day. It's approaching UK, Singapore. They opened up. They said, no, they would be safe to live with the virus. And then the death number grows very quickly. Also, so that's my my sharing, that I hope we can continue the orientation aiming at zero, that we would like to live with freedom instead of live with the virus. The virus is still a beast. If you live with it, you will people will be killed. Okay, thank you.
Thank you very much, Shu-Ti. Are there questions, please? Shu-Ti, maybe you want to close your screen so we can respond to questions.
Okay.
Who has a question? Please post a question in the chat, or you can unmute. I think that maybe we will go to Sunil, Raina for the next presentation. Shu-Ti, you can stick around because there may be some additional questions, please.
Okay.
And let me put Sunil in the speaker slot. Sunil, if you can, I don't know if you can share your image. And do you want to project or you want to just talk?
I would just talk, no projections. Thank you, Yanir, for inviting me. And the one question that I've been trying to answer for past 5-6 months, and that's constantly asked from me, was India successful or has India done enough as far as this pandemic is concerned? The answer could be a yes and a no. For the fact that for large part of this pandemic, we have been in control. If you look at the large parts of 2020 and the earlier parts of 2021, we were in control because the numbers in India were not very high. And in fact, we have been able to reduce the numbers by the early parts of 2021. But we lost it midway in the month of May 2021, and the numbers again started increasing, partially because of the fact that Delta struck us, and we didn't anticipate it, as also because of the fact that we we reduced the restrictions that we had imposed earlier on in this pandemic. So could we have done better as far as this pandemic is concerned than we actually did? I probably think we could have done. Now the insights that we have at our hand and the insights that we keep talking of in Indian circles, we think we could have done better because we had 2 or 3 advantages which no other nation in the world did have. One, we had a very good primary care setup, a very good and robust public healthcare system, which was always there with us. We didn't have to look for it, search for it, establish it during the pandemic itself. Second, we had a very good community connect, which we identified later on in the pandemic when we talked about it, and we could speak to the governments across India about utilizing that community connect. And third and important was that we had strong social service schemes in place, which we utilized again in the second part of the pandemic much more effectively than we did in the first part of the pandemic. So what did India suffer from, or why did we suffer from the fact that we didn't control it as well? Probably like all other nations across the world, we were fearful. The world might have been fearful for the fact that they thought that elimination strategy will compromise liberty. In India, we were fearful of the fact that the elimination strategy will compromise livelihood. So that was probably one fear with which we always went into this pandemic. And maybe because of that, we couldn't do it as effectively as we thought we should have been able to do it. But still, we have been successful in certain areas, and there are a large number of success stories that have been coming from India. One we talk about is Dharavi, which has been an excellent story. We have been able to control the pandemic in probably the biggest slum across the world. It's a known fact that it is the biggest slum in Asia, with a population of more than 1 million spread in a very small area of 2.5 kilometers. So we could control it there. We have been able to be largely successful in second part of the pandemic to be able to control it in the largest state in India, the Uttar Pradesh, which has a population of around 200 million. So we have been able to have those stories with us. But as I said, we could have done better. And but for the lack of the insights at the beginning of the pandemic, when we were evolving to control it, we could have done it better. So what did we do? India imposed its lockdown in the month of March 2020. By the end of March 2020, we could go into lockdown when the number of cases was not very high. The total number of cases at that point in time was around 500, but we went for a strict lockdown, thinking on the fact that if we are able to save lives, we were able to save the world. That was the key message that was delivered to the common citizenry of India, that saving lives is the primary concern for us. Over a period of time, we did relax this lockdown. And by middle of April and the beginning of the month of May, the talk shifted to the fact that we have to ensure both life as well as livelihood. So and then we started beginning relaxing as far as restrictions were concerned. But we still did have a large amount of restrictions in place. For example, schools continued to be closed. In fact, some states continued to have the schools shut down till date. They have not opened for last 1.5 years. A few states have opened up partially in the sense that they have allowed 50% of students to attend classes in person, while the rest can attend online. So these restrictions continue to be in place. Travel was always a part of restrictions, which was kept there for a long period of time. So if you had to move from one state to another, you had to have an RT-PCR negative report in the earlier part, and now you still need to have a vaccination certificate that you are doubly vaccinated if you want to travel from one place to another place without any intervention, without any questions being asked. So you have to have these vaccination certificates in place. So travel and school closure was there as a part of restriction till a large part of 2020. And it was only by the end of 2020 when the numbers started dropping down. We had the lowest numbers post September 2020, and we started reducing the restrictions, loosening the restrictions. And that's probably what may have been our undoing. By February, the numbers were around 9 to 11,000. We wrote about it, that the numbers are low. We need to be careful because they can rise anytime. But unfortunately, we didn't respond. The government didn't respond to our advice. And the fact that we launched at our vaccination campaign at the same point in time, opened up at the same point in time, and the numbers started rising again in the month of May. So these were some of the things that happened in past. But I would not like to talk about this. I would like to talk about something that has been doing well, or that has helped us be successful in the current context. For example, Uttar Pradesh, or the Dharavi story that I talked about. So as I said, the fact that we had strong community connect and we had strong public healthcare system in place, as also the fact that we had good social service schemes in place, we could be successful or partially successful in certain areas of this country. We have been able to limit it to certain geographies only because of these schemes in place. So the three things that helped us in these areas to achieve success was, one was the livelihood scheme, or whereby we could ensure the fact that in the lockdown, the people who were deprived of their jobs, or who were deprived of the fact that they were able to earn their livelihood being daily wages, could be compensated. Now, India runs a scheme which is known as the Antyodaya Yojana, which is AAY Yojana. Now, what does this scheme mean? It means that around 25 million Indians who are the poorest of the poor are able to receive food in terms of rice and wheat at a very low cost. So roughly less than a cost of 4 cents per kilogram of rice or wheat is given to these very poorest of the poor in India. 35 kilograms of rice or wheat at this rate is given to them every month to help them live to help them have food on a daily basis. Now, in this pandemic, what did we do? That we extended this scheme to others as well. So all of those who are likely to lose their jobs because of the fact that lockdown was in place or restrictions were in place, there is a likelihood that all daily wage earners may lose their jobs. So their chances of having food on their plate was reduced. So this 2.25 million people who used to get these subsidized rations got this food free of cost for this entire period of lockdown. In fact, this has been extended to September 2021. So till September 2021, all those poor people who were hand to mouth as far as food was concerned were provided free food. This scheme was also extended to another 800 million people on a timely basis, so that most of the people who couldn't meet out with their daily needs of food could receive food free of cost through these ration depots that are put in place across the country to get food. So that was one scheme that probably would have ensured or helped the country to suffer the consequences of the lockdown, about which everybody across the world was worried that how India will embark on a lockdown, considering the fact that it's a very poor nation, its people don't have enough of food to feed themselves. So that was one scheme that probably helped us to overcome the complications of lockdown as far as poor were concerned. Second, as I said, was we had a very good public healthcare system in place. So if you look at India, and Uttar Pradesh is an excellent example, Uttar Pradesh and other parts of India were able to reach out to every village of the state as well as other parts of the country through a team of workers who are there because of this strong public health care system. So every village in India has an accredited social health activist. It is a community-based healthcare worker. With the help of these accredited social health activists and auxiliary nurse midwives, they could reach out to every village, test those people who were symptomatic, screen them initially, test them, and manage them only in their village populations only. That ensured that these people who stayed in their villages were not allowed to move to the city areas, and thereby increase the traffic to the city areas and carry infection to and fro from these city areas. Now, this was carried entirely across all villages of Uttar Pradesh under a scheme known as Mera Bharat Corona Mukt, My Village Free of Corona. And this scheme has been successful in reducing the numbers in Uttar Pradesh. If you look at the current numbers in Uttar Pradesh, the numbers are in a single digit now. Yesterday it was 4, today it is 7. So the numbers have been reducing constantly in Uttar Pradesh because of this very scheme. There have been some additional schemes that have been able to, as I said, circumvent the impact of lockdown. One that I would like to talk about is the Mukhyamantri Bal Seva Yojana. Now, under the scheme, what they did was that anybody or any child who lost a parent to this pandemic is being compensated through monetary benefits as well as through other social service schemes. So every individual or every child who loses a parent is given 4,000 Indian rupees to survive, as also if there's an occasion of marriage, for example, in his family, the state bears the cost for that. So some of these schemes have been helpful in Uttar Pradesh, and most of these schemes are being planned to be implemented across the country in different phases of manner. Now, what exactly do we need to do now? What exactly is the need to do now? Probably with the fact that vaccination has been found to be one single agenda that is running the country at this point in time, we also need to take care of the other facts. And then, unfortunately for us, we have not dropped down on the mask mandate that is in place since the beginning of the pandemic. We still continue to use masks in offices. We still continue to use masks in indoor spaces, as well as in most of the outdoor spaces. So if you are attending a marriage at this point in time with limited attendance that is allowed, you are asked to wear a mask. If you are going out to do shopping in festivals, which are there at this point in time, you are asked to attend a mask, and you could be fined for that if you are not wearing a mask in public place. So probably some of these things that are there need to be continued for a long period of time. And we also need to think elimination. Unless and until we continue to think elimination in India, we will not be able to control it. Fortunately for us, the politics in India is thinking of elimination all the time. It has not dropped down on its concept of elimination. And I don't hear any of my political leaders, most importantly my Prime Minister, I don't hear him saying that we need to live with the virus. He always speaks of a single thing, that we need to get rid of the virus. The disease is there. We need to be strict. In fact, yesterday only he talked about the fact that dawai bhi kadai bhi, that was the meaning of which was that we got to go with vaccination, but we also need to go with restrictions. The restrictions cannot be limited despite the fact that we may be successful on the vaccination front. So that probably sums up India, and we hope that our politics continues to use this elimination strategy, because I probably think that's the only way for us in India, and that probably is the only way for the rest of the world. Because if India is successful, I continue to think it this way. If India is successful, the rest of the world will at least have a model which will tell them that despite resource constraints, despite not being rich in money, despite not having the technological advances that other countries may have, India has been able to successfully eliminate the pandemic. Thank you.
Thank you very much, Sunil. Now we have our three speakers are still here, and there's an opportunity to have conversation and questions. Please turn. I think that the top row can unmute. The bottom row probably has to post in the chat. Either way, please go ahead and ask questions if you have them. And let me just ask, Sunil, could you say a few words, because we've spoken about this, and I would really like to understand better the impact. There is a puppet show that was developed in government collaboration with UNICEF that has been shown in India widely. And again, in India, there has been consistently remote learning for children, but this puppet show has always impressed me as something that could be playing a very big role. Could you describe it, please? And maybe I'll put a link to the YouTube channel. Please go ahead.
Thank you. I will just need a few more seconds to answer this. Now, if you look at India's national television, it evolved in a particular manner. The initial part of India's national television was to deliver education to India's population in the rural and the remote areas. So what they did initially, as far as India's television was concerned, every village had a village gathering sort of a thing. And in this village gathering place, they had a television which was installed there. So in the middle of the day, around 11 to 1, they would beam a TV show on these television sets, and which were educative in nature. So that's how India's television evolved over a period of time. So taking a cue from that, what happened during this pandemic was that India embarked on this provision of education through this television network, which was India's national television, one, as well as the online mode of teaching. So for the online mode of teaching, they provided the schools with the capacity to beam live knowledge, beam live classes to individuals' home, for which individual was asked to use a telephone or a laptop for that matter. And a large part of India did use it. In fact, a survey said that 60% of Indian students did receive education through telephones, mobile telephony, or through laptops. But I would say 60% is a lesser number, and we should have been able to get it up. But rest of it was probably compensated by the fact that India's national television did deliver schooling through its national network as also. Now, taking a cue from this, what Uttar Pradesh did in consultation with UNICEF was that they developed a 10-part series, which was known as Tara Hai Taiyar, which means that Tara is ready. Now, this was primarily targeted at children because of the fact that Uttar Pradesh feared that the third wave will be impacting the kids in the most profound manner. So what did they do was that this 10-part series was divided into different episodes. For example, an episode in this would talk about the use of hand hygiene. Another episode will talk about the use of hand sanitation. Third will talk of use of masks. So these 10-part series was delivered to the houses in Uttar Pradesh through this national television, which I talked about, the Doordarshan, as also through a private channel, which is the Z network. So they will telecast it on a daily basis throughout the state of Uttar Pradesh. And in fact, another report that came on this was 80% of Uttar Pradesh's population did get an access to this Tara Hai Taiyar scheme, which was launched by Government of Uttar Pradesh in consultation with UNICEF itself. The protagonist of the series was a 7-year-old girl who would talk to her father and would talk to her father about the impact of lockdown and how exactly do they need to come out of the lockdown, and what are the different ways with which they will be able to meet the impact of the lockdown, as also the fact that how do they need to prepare for the third wave if and when it does come to us.
Thank you, Sunil. I posted in the chat the link, and let me just add something to Sunil's comments, because once I learned about this show, it really struck me very strongly, because what we've seen in much of the world is a resistance to information that is presented to adults. But when children learn information that's very direct in a pedagogical way, not only the children learn that information, but of course the adults learn that information too, because they're all watching the show with the children. And it doesn't come to them in the same way. And I think that this is a tremendous lesson that we might learn also for the rest of the world. And I would love to produce such shows if anybody would like to participate in making it happen. In any case, are there other questions, please? Tracy is actually asking, any chance it can be translated and shared to other languages? What do you think, Sunil? Should we?
It can be. I think it can be. If we can work this out, we can talk to the government of Uttar Pradesh. As also the fact that UNICEF is involved, this can be. And it's not a difficult job, because the fact that at this point in time, the technology is so advanced that it could be. We just need to speak to them, and if they allow us, we can use the entire show as such and get it translated into English and other languages.
It is now in Hindi, right? This is the language.
It's now in Hindi.
Yeah. Other questions? So it is now 10:15 in the US, and I know that it's very different times in other parts of the world, in particular with our three speakers. I would really like to thank them very much. I think this session has been incredibly important in sharing information globally. And let me just say that this is one of the reasons that the World Health Network has been formed. Because what we've seen over and over again is that there are different kinds of ideas that have been developed in different places in the world. And what has impressed me is that if we could share the best ideas around the world, we would be much more successful in confronting this pandemic. And in general, of course, this is the best way that we can confront challenges overall. Does anybody else have any questions before we close? I think that this is so there's a question about summary. There will be the video that will be available. We will turn it off the filming, and I would like to encourage everyone to carry this information and to learn from it so that we can be continuing to advance